Hospital interjection. A hospital is one of the public facilities that can be used by people to get health services. There are several departments in the hospital according to patient complaints, such as the inpatient department, outpatient department, IGD, ICU, and another which will be explained in this video.
Inpatient department. The inpatient department is a form of hospital healthcare service with a system of patients staying at least one day. The service offered are individualized, which include observation, diagnosis, treatment, medical rehabilitation by staying in an inpatient room. Inpatient rooms are ward rooms that contain beds, pillows, blankets, small storage boxes, and are occupied by several patients at once. Some hospitals also provide certain class categories such as VIP class, VVIP class, and executive. The department is used by patients who require intensive care or continuous monitoring. Patients admitted to the inpatient department usually have medical conditions that require more medical intervention than outpatient. The medical team at the inpatient department consists of doctors, nurses, psychotherapists, and other healthcare professionals tasked with providing intensive care. Outpatient service. Outpatient service provide medical care to patients without having to stay in the hospital. Designed for efficient service for patients who require routine care, periodic checkups, or specific treatment. The system involves patients making an appointment with a doctor or specialist for a medical consultation or procedure. The medical team at this service consists of doctors, nurses, medical assistant, and administrative personnel. The difference with the inpatient department is that patients in outpatient care do not stay in the hospital. Their treatment is shorter and more specific.
The Emergency Department ID. The Emergency Department ID is the part of the hospital that provides initial treatment for patients suffering from illness and injury, which can threaten their survival. Emergency is a life-threatening and unpredictable situation. In the emergency room, the medical team on duty includes doctors from various specialties along with nurse and duty doctor. The emergency department functions to provide emergency medical service for 24 hours a day and 7 days a week. The emergency department is also equipped with bedside monitor, defibrillator, infusion pump, sharing pump, suction pump, emergency kit, ventilator, infrared warmer, and incubator. The Intensive Care Unit ICU. The Intensive Care Unit ICU is a part of a hospital that is intensive and equipped with specialist medical equipment that aims to treat patients who suffer from disease, injuries, or can be life-threatening. Services in the ICU are not limited to treating post-surgical patients only, but also include the treatment of various adult, pediatric, or elderly patients who experience organ dysfunction. Patients in the ICU can come from the emergency unit, operating rooms, treatment rooms, or shipments from other hospitals. Medical equipment in the ICU are electrical bed patient, ventilator, bedside monitor, central suction, defibrillator, and others. Medical personnel in charge of the ICU are specialist doctor and ICU nurse.
Laboratory installation. The laboratory installation is installation in the hospital to examine patient specimen as a sporting examination to help diagnose disease. Examples of specimens are blood sample, urine sample, and saliva specimen. Hospital laboratories involve several workers such as laboratory technical to take sample, perform laboratory tests. Then, laboratory experts are tasked with interpreting test results and consulting with doctor. Then, there is a pathologist or a doctor specializing in diagnosing disease. Laboratory equipment used such as microscope, urine test kits such as analyzer, lab centrifuge, and basic laboratory equipment such as beaker, straw, glass tub or burette, test tub, mortar, and spatula to take solid chemicals. Pharmacy Department. The hospital pharmacy department is an important unit in a healthcare institution that is responsible for the management of drugs. This department has a vital role in ensuring patient reception, appropriate and effective treatment. The pharmacy department is led by a pharmacist. The duties of the pharmacy department are to carry out planning, procurement, production related to health, and dispensing of drugs based on a doctor prescription for inpatient, cancer, diabetes, and other. The type of equipment that are often found in the pharmacy department are blister packaging equipment, liquid measuring device such as measuring cup or volumetric straw, scale for measuring drug weight, and drug strong equipment. Dialysis Department. The dialysis department is a department that is required to treat patients with diseases such as kidney disease. Usually, the duty of the dialysis department are carried out by a doctor or nurse who has a dialysis training certificate. There are two types of dialysis, namely hemodialysis and peritoneal dialysis. Hemodialysis is a blood cleansing or dialysis procedure using a hemodialyzer, while peritoneal dialysis is a dialysis department that installs a catheter inside the abdomen to insert fluid to draw toxic from the body. The tools that are often used are hemodialysis machine, dialysis or blood filter to filter the blood and remove impurities from the blood during the dialysis process. Peritoneal dialysis machine in a patient undergoing peritoneal dialysis fluid.
Hospital operating rooms are specialist areas used by medical teams to perform surgery and other medical procedures. The operating rooms must have high hygiene and sterilization standards to reduce the risk of infection. In the operating rooms, there are complex and modern medical equipment such as operating tables, operating tools, heart monitor, and more. The operating room is also equipped with a good ventilation system to maintain the air quality in the room. Some conditions that often require medical action in a hospital operating room include major surgery, as tumor removal or organ transplantation, orthopedic surgery, such as joint replacement or bone repair, cardiac surgery, such as heart bypass or heart valve surgery, neurosurgery, such as brain tumor removal or nerve, stimulator insertion, plastic surgery, such as reconstructive surgery or burn revival. The medical team in the charge of the operating room are surgeons, surgical nurse, surgical assistant, and anesthesiologists.
Radiology room. The radiology room is a medical support facility that provides imaging service such as electromagnetic wave or mechanical wave imaging to scan the inside of the human body and detect a disease with the result of the examination in the form of image. The system involves infrastructure and procedure using imaging technologies such as X-ray machine, CT scan, MRIs, which are an integral part of the system. The radiology room consists of the examination rooms, scan image processing center, chemical storage rooms, and radiation protecting rooms to protect staff from radiation exposure. Medical personnel on duty include radiographer, CT scan technician, and radiology physician who have responsibility for the operation and interpretation of the result from the radiology system.